Ziua tuturor! Astăzi o să discutăm despre celule STEM și despre medicină regenerativă cu două persoane foarte importante la nivel mondial. Prabhu Mishra, care este cercetător științific și a studiat și lucrează în domeniul celulelor STEM de peste 15 ani. Acesta este domeniul lui principal de activitate, iar interesul, în mod special, este în infertilitate și în regenerarea ovariană și a endometrului, de exemplu, pentru insuficiență ovariană prematură sau pentru sindrom Asherman, pentru dificil de implantare a embrionului. O să ne spună el mai multe despre acest lucru. Și doctorul Rashad Haddad, care este din Franța și locuiește momentan în Dubai, deci practic reprezintă și Franța și Dubai în acest moment, și să ne discutăm împreună despre medicina regenerativă. Vom vorbi în engleză însă. Sper să pun și traducerea cât mai curând și pentru cei care nu înțeleg atât de bine engleza și doresc să vadă traducerea în limba română, dar momentan vom discuta într-o limbă internațională și anume în limba engleză. So good day everyone, good day Prabhu, good day Dr. Rashad, how are you?
Thank you.
Dr. Rashad is our host here in Dubai. We are in Dubai now, so thank you for inviting us.
Most welcome. It's my honor to welcome both of you, dear friends, and well-known personality in the regenerative medical field.
Thank you so much. Thank you. Prabhu came from India, from New Delhi. So, how is India now?
Oh, good. It's really recovering from the COVID, and no doubt this COVID have given challenges to many of us across the globe. But fine, we always think like every challenge brings some new opportunities. So this new platform to communicate, new platform to educate and interact with everyone.
Exactly. Now the development of online medicine, online courses, online trainings, everything brings us closer one to each other, because we can have a meeting, online meeting with someone from the USA, from Dubai, from India, from Romania, from Poland, from everywhere, and we can all be together, even if we are located geographically in different places,
Absolutely.
right?
Absolutely.
What do you think about this period now, 2020? How was it?
I think it was a good experience if we will look to the positive side. Okay, we believe more and more in science. We believe that a human being can do things more positive when there is the will, the science, the knowledge, and the tools for it. And we see that that time was really, we were in a race with that time, and I think we are on the winning part against what's this COVID-19, with all the vaccines available, and I'm sure in a few weeks we will see more and more treatments and more solution. So at the end of the time, I'm positively happy.
Okay. Thank you so much. So now let's start. Maybe I think you're more curious about first the stem cell, because now it's the future of medicine, and it's becoming more and more available. This is the important thing, and this brings us a lot of hope in order to treat some pathologies and some conditions that before of this were considered untreatable. So Prabhu Mishra is the best person to tell us about the stem cell in order to understand how these stem cells are, how can we get these stem cells, and how can we use it, and for what?
See, stem cell, if you'll see, this is the most debatable science of the 21st century. And regenerative medicine is the branch. Stem cell is one of the part of that areas. There is many terminology, if you'll see, the cell-based therapy, like platelet-rich plasma or amniotic graft, and umbilical cord blood bankings, biobankings, medical devices which are required for the processing of these stem cells, regenerative compounds like granulocyte colony stimulating factors. So these all areas which combines and make this field separately a regenerative medicine. And no doubt, the basic principle, as the name suggests, regenerative medicine. So it work on the principle of regeneration, re-engineering, rejuvenate, restorations of the damaged cells and tissues. So stem cells, if you'll say, stem cells means basically the cells something which are responsible for self-renewing, which may differentiate into the targeted cells and organ, whatever the damage into the body we are aiming to regenerate, repair, or
So
rejuvenate.
simply for the patients, we take some cells from our own body that naturally have the mechanism in order to regenerate the tissue. So we have this and they know what to do it. We just take them and use them, right? Something like this. So to explain for people to understand, because it's a lot of scientific language, but just for the patient to understand how these treatments can help them and how they get the stem cell. Because when you think about stem cell, I think most of them think about embryonic stem cell or from the cord. When you deliver and they ask you if you want the cord and the blood banking for stem cell, right?
Yeah. See, there is if you see many sources of the stem cells, Dr. Diana said embryonic stem cells, which are many ethical and regulatory challenges and scientific challenges as well for embryonic stem cells. Then umbilical cord blood, which indications, which disease, what sort, what much of the cells volume, cells count, route of administration. These are still associated as a major challenges with many of the diseases. But if you see, there is bone marrow transplant, the BMT, hematopoietic stem cell transplant, which called that is where you require the donor for cancers, which are already a proven treatment.
Explain a little for people what is bone marrow stem cell means practical.
See, there is two terminology, scientific terminology. If you say autologous stem cells, allogenic stem cells. If patient is itself a donor, if the stem cell source is patient itself, it's an autologous. When you require the donor, if they are donating something, that's an allogenic. So allogenic bone marrow transplant currently practiced as autologous and allogenic, both in case of cancer or any blood-related disorders like sickle cell anemia, thalassemia, and aplastic anemia, and many other cancers. Nowadays in clinics, there is many other applications came into the picture for bone marrow stem cells that is from patient itself, minimally manipulated, not majorly changed, not added any chemical or reagents to modify their basic nature, and then used for a specific disease. Like if you'll see in a diabetes, liver cirrhosis, in orthopedic many indications like osteoarthritis, avascular necrosis. In gynecology, some of the clinical trials are very promising, which are core area of our research as well, like premature ovarian failure or Esserman syndrome. So these all are bringing hope for many of the indications.
So just to summarize, so we can have these bone marrow stem cells from our own body, usually from the iliac crest, from the hip bone, okay, right?
Yeah.
Or we can, and this is like allogenic, autologous stem cell. It's from our own body, and we use it ourselves. Or we can have stem cells from another person and use it in order to treat some disease. So these are the two types of stem cell from the bone marrow, okay? And how much time does this procedure take to take the stem cell from the bone marrow, for example, and to prepare it and to inject in your own body, for example, for premature ovarian failure? Premature ovarian failure means that you are not at the age of menopause, but your ovaries do not have any oocytes. The reserve is very low, and these patients will go to menopause like at 42, 45 years old, and of course they cannot have any children. So in order to treat this, we didn't usually we send these patients to oocyte donation. So we send them to take oocytes from other patients and use them because they don't have their own. But now it is possible for the ovary to be rejuvenated with the stem cells. So in this procedure, it's possible in Romania, for example, it's not possible, but I want to start and eventually to bring it to Romania as well. For now, we can do this in India at Prabhu Mishra Center. And this is why, because it requires to travel from your country to India. How many days the patient has to stay there, for example?
You see, most of the time it goes in various steps. They do have to all of the tests, like all your blood protein test and all hormones. And as you are a gynecologist, you do all basic examinations initially. If you'll see the stem cells or cell-based therapy part there, bone marrow aspiration, it takes around 30 minutes, which is done by the pathologist or hematologist or by the orthopedic surgeon. Then the preparation part done into the lab or by the point of care devices, which are especially meant for the separate the make the concentrate. Bone marrow aspirated concentrate is the scientific terminology for minimally manipulated bone marrow stem cells. So that contains many cocktails of stem cells and growth factors and cytokines, which are responsible for neovascularize and regenerate and rejuvenate the desired cells and tissues. And then the injections, once this preparation times take around 30 minutes to 45 minutes, bone marrow aspiration 30 minutes around, then 30 to 45 minutes is the harvesting period. And then either you can inject laparoscopically or the transvaginally to the ovary. So this is the how. So it's almost a daycare procedure, but after again, and because it's an holistic treatment, you require a combinational approach with some hormones and other. Then they further go for the gynecological consultation.
Okay. So do you use here in Dubai stem cell?
Some centers they use stem cells. Is not the best production. Regulation is highly regulated. They use stem cells in medicine.
So in some fields.
Some center, specialized center.
And for example, what kind of regenerative therapy?
The use of, if we will not talk about the machine or energy-based device, and we will stay on the same spirit of our discussion, we can talk about the use and the vast use of PRP. PRP, it's a platelet-rich plasma. Platelets is component of our blood. These platelets, inside there is a lot of factors. One of them we are important, very important in our discussion today, is the growth factors. And growth factor, there is 10th of growth factor, depends on the indication. If we will not go in complicated scientific discussion, we say we extract our blood, we centrifuge it. Within this centrifugation, depends on the technique we use, we can separate the platelet-rich part of this plasma. We take this platelet-rich. If I say platelet-rich, mean there is rich in growth factor, and we inject on the desired area. Desired area, it's common, could be aesthetic in the skin and depends what concentration we need. Could be like my colleague, the orthopedics, they use it to regenerate for any degenerative disease in the joints. Could be our colleague in urology, they do it for male sexual dysfunction. In gynecology, we use it for multiple reasons. Could be female sexual dysfunction, could be for regenerative of the lower part of the female genitalia, like vagina, vulva, etc. As well, it could be used, as Dr. Prabhu and Dr. Diana talk about, we can use it for regenerative effect on the ovaries itself or the lining of the uterus. So to summarize in 3 words, this is our own blood concentrated. We take the platelet, we extract, we need the growth factor from the platelets, and we use it on the organ desired under aseptic and controlled medical procedures.
Yes, because this is the beauty of our blood. So it's like a normal blood test. You don't feel anything different. You just collect a tube of blood like we normally do when you have any other test. And then after this centrifugation, this mechanism, we can use it, and the platelets and the growth factors, after this, we inject it in the area that we want to treat. For example, like you said, these indications, there are, for example, for hair growth, for alopecia, for dentistry as well. So why does this treatment work in so many different areas? Maybe you can say why. So we have people will say, oh, but this is a miracle. So you take this thing and you can use it for so many different pathologies. But it's very logical, and
Prabhu will explain. Stem cells currently, if you'll see, it's not a magic medicine.
By the way, does PRP, because this is a usual question, does PRP have stem cell?
See, PRP is not an stem cells at all. That's why another terminology is a cell-based products or cell-based therapy. Platelet-rich plasma, what does it mean? Basically, see, as Dr. Rashad said very clearly, like it's a component of one of the blood parts. So one of the component that is and platelet-rich plasma, that is from the baseline, there should be some of the concentrated volume. That is in 1 cc of the things, the platelet concentration should be from the baseline 4x, 5x, 10x. So this is what the platelet-rich plasma, and it contains basically all cytokines, anti-inflammatory cytokines, and maybe neovascularizing cytokines, and many other growth factors. That means either it gives the strong immunomodulatory effects or anti-inflammatory effects and the regenerative effect. It's a growth factor, it's a function, as rightly told by Dr. Haddad.
So because, for example, if you hurt your hand, or for example, you fell on the stairs, or for example, you cut your finger when you're preparing food, it's a trauma, and naturally, these platelets and the plasma and the growth factors and everything will come in that spot, in that area, in order to heal it. Okay, so it's a natural process. So this is why you can use this platelet-rich plasma from your own blood in order to heal different parts of the body. Am I saying correctly?
Perfectly.
Okay, so what about, so you said like in one day, the patients will have the stem cell and the stem cell therapy, and then they can go back to their countries?
Generally 3-4 days they need to be there, because firstly, because it's a minimally invasive procedure, so preferably to be in hospital that day, and it's a
with general anesthesia.
Yeah, of course, because so it should be under guidance of their respective gynecologist at our center, and then generally you can go for the holistic approach we do provide, but it's an optional, because it's like you can choose for the hormone management, but we always prefer to suggest whomsoever is their gynecologist, they know their hormone cycle quite better than at our center. So that's why our core focus is only stem cells, and we recommend them go to your respective gynecologist. It's always better, because they know your cycles much better than in one day to consult with at our center.
Mm-hmm. Dr. Rashad is very good with the hormonal therapy. Maybe you can tell patients a little about these things, because in Romania, the patients are very afraid of using hormonal therapy, even if for contraception or after menopause, when in a lot of countries, the hormonal replacement therapy is used on a large scale, but in Romania, patients are very afraid because they say it will give me cancer, it will give me certain problems. So what can you tell them about?
Hormones, first of all, they are a normal component of our own body. We have multiple glands, we call it endocrine glands, secreting hormones in our body. Usually doctors, regardless the specialty, they use the hormone replacement when there is less functioning of the gland. The most common example, the thyroid gland. When there is less thyroid secretion or dysfunction, we replace it. I need to have my thyroid at that level. It's at this level. We give a replacement to make the thyroid functioning in a normal way. What's going with the thyroid? It goes with any other gland, even let's say with a male hormone. If there is less testosterone, we give testosterone. For the ladies, if there is less estrogen or progesterone, we replace it in a different value. So why this anxiety that Dr. Diana said about Romania, but it's everywhere in the world? I think it's in a different scale. Because we read, and some study mentioned, that hormones may lead to cancer. Let's make going more basic things. If I don't have headache, I don't take paracetamol treatment. If I don't have infection, I don't take antibiotics. If I don't have needs of hormones, I will not take hormones. Hormones, certain hormones, especially synthetic hormones, if taken in high-risk patient of breast cancer, that's the most common fear, okay, it will not create breast cancer, but it may activate a breast cancer existing already. That's why doctors choose the right patient where there is less dangerous or less fear of breast cancer. They do certain exam like mammogram, breast ultrasound, hormonal study, and they give it under control. In this case, the risk, it will be almost like the risk of any other lady without any family or genetic history. So I think hormone replacement therapy, it's part and essential part of the regenerative medicine. We cannot talk nowadays in 2021 about regenerative medicine without talking about hormones. I will use word that I use it frequently, Dr. Prabhu just use it. We cannot approach a regenerative medicine without this holistic approach. Means when we approach the regenerative medicine should be by multiple aspects, because we are correcting small defect and re-engineering another small defects.
Exactly. So according to the patient's characteristic, if she needs it, we can use hormonal replacement therapy with PRP in some areas, with stem cell in some areas, with the laser in some areas, with radio frequency in some areas, depending on what the patient needs. We can use different type of regenerative medicine, because the idea is that regenerative medicine is not only stem cell, it's not only hormones, it's not only PRP, it's not only laser, but it's all of these treatments, injectable treatments, and device-based treatments and everything, in order to repair and regenerate, like you said, the cells, the tissue, and the organs. So what can you tell patients to be, like you said, with hormones? Can stem cell therapy cause any damage to the patient? Should they be worried about certain things, about cancer or other things as well?
See, autologous adult stem cells is generally not from any kind of cancer related. Many of the clinical trials have been done.
Explain a little what is adult stem cell.
See, adult stem cells, if you'll see, up to 16 weeks of the pregnancy, after fertilization, these cells are embryonic stem cells.
So the fetus inside the womb of the mother, until 16 weeks, it's an
embryonic
stem cells, and after the 16 weeks, it's adult
stem cells. Because even umbilical cord blood, which you are banking, these are adult stem cell source. And here, in this clinical setup of regenerative medicine, we are using like from the bone marrow, patient own bone marrow, or adipose, or the peripheral blood. These all are adult stem cells. And the teratoma formation is the basic property, one of the property of the embryonic stem cells. Generally, adult stem cells not proliferate in that level.
Only a second, tell me a little about the teratoma. What is teratoma?
Teratoma is the tumor formation, the cancer formation. The main question is the stem cell. Sometimes this question comes from the patient, is the stem cell forms the cancer? Generally not. Many of the clinical trials have been conducted, many of the researches. Adult stem cells is already differentiated cells and has the less differentiation capacity. So not much risk, because it's from, first of all, it's from their own body source, from the same cell lineages.
And for example, if we inject the stem cells or the PRP in the ovaries, some people say that you don't know if it will not cause, not really cause, but enhance the risk of having ovarian cancer in the future. What do you think?
See, we are working in collaboration with many of the gynecologists, like many countries, many of the, even Dr. Haddad is there, you are one of the collaborators in that project, and many other countries. So if you'll see, these all are adult stem cells. Ovary is already atrophic in that case. And you just injecting the very minimal volume of around 2 cc of the, in each ovary 2 cc. So first of all, it works on the mechanism. If you'll see the mechanism, how it's working, like what is basically this aspirated concentrate? It's an anti-inflammatory, immunomodulatory. It gives the anti-apoptotic effects, the most important, and the anti-fibrotic effects. So basically, overall, if you'll see this scientific terminology in accumulations, they enhance the basically hematopoiesis and neovascularization inside that. So it's regulated because it comes from already a differentiated source of the cells. So it's not like it may proliferate like anything. Until date, many of the patients in collaboration in total, if you'll see more than 400 patients experience at our center in this condition.
How many? 400?
Yeah, more than 400.
So we had 400
So,
patients.
and
That's
none
why
of
I
the
asked
patients,
him
yeah,
what the experience.
none of the
400
patients have reported. Even recently, we have published one paper. So even that study was very nice study.
Mhm. So they shouldn't be afraid of using stem cell or the PRP in order to enhance their chances to have a pregnancy.
Of course, definitely there should be a controlled clinical trials with large number of holes. There is a lack of data currently because this science is still on a very initial stage. We should do a multicentric trial to increase the number of patients to this science, because then we can go for the cultured cells like pure mesenchymal stem cells from the hole. So many of the source are
Tell a little what is the cultured.
Cultured cells means like you have taken the adipose tissues.
So from the fat, you take the fat and you put it into a process in order to extract the stem cells from your own fat. Okay, so for example, from liposuction, and then you use this fat in order to have the stem cells.
Yeah, because fat is well established. Plastic surgeon using for the any filler effects from the face to the breast to the buttock. So that's a fat grafting. Then you get the nano fat. That's homogenized fat molecules. Again, it's for volume whitening effects. Then you go for the stromal vascular fraction is one of the very popular nowadays. That goes for the knees and many other regenerative tissues. And then when you are culturing this SVF, stromal vascular fraction, that is culture means you take that cells to the clean room, to a lab, and you grow them. You grow them to a specific population of the cells. You want a chondrocyte for cartilage, you want the oogonial cells for the for ovary, you want the osteoblast for the bone formation. So then specific cells can be grown inside the laboratory. And that may be one of the sources, mesenchymal stem cells. Mesenchymal stem cells can also be extracted from that. And that mesenchymal stem cells is a highly potent cell, highly immunomodulatory, and very specific. It can be a cell specific. If we want to treat only for the cartilage, it can be cartilage culture cells.
People understand stem cells are the cells that are not differentiated now. So we can use them as they are, or we can take them and then we can stimulate them, culture them in order to grow specialized cells, like he said, like so to chondrocytes, to myocytes, for muscles, for cartilage, for different things, because all our body is made from these stem cells that at first didn't have a direction. There were only these cells, okay? And then they started, you go this direction, you form the blood, you form the brain, you form the hands, the heart, everything, okay? So they are specialized in different domains. So you can use it as they are, like undifferentiated, or you can culture them in the laboratory, like you said, to a specific kind of tissue. And for, I wanted to say, for people that are interested, we really believe that this is the future of medicine, and a lot of doctors should know about this, even if you are a scientist, or you are orthopedics, you are dentist, you are whatever. So you can use this regenerative medicine. Of course, we are gynecologists, so we use it in gynecology. But this is not all of the regenerative medicine field, of course. It's only one little part. So people should know about this in order to help their patients, to bring hope for different pathologies. And this is why we organize courses and congress in order to, so if the doctors will know better about this from all over the world, they can treat their patients from their countries, and they can have this new approach for the pathologies, right?
I think regenerative medicine, it's we talk about it for the last 2 decades, but I'm sure, certain, that it will be the pioneer in the future. Okay, it doesn't mean we will forget all the surgery, all the pharmaceutical products, or whatever you are using. But if we are depending more about the auto repair, auto engineering, and auto restructuring by the regenerative medicine, using what my friends and colleagues just talked about it, this is surely the beautiful side of the future medicine. As Dr. Tiana said, this science, we should not monopolize it for certain elite of doctors or population. That's why congresses, symposiums, seminars, formation, physical or online, are very important. If I will not use it in cardiology, at least I know as a doctor that science exists. And general population, they should know the existence of it. Doctors in general, they will form about the existence, and each one will form in his or her specialty. This is the future. Let's build it together. Let's believe in science and believe again on the very, very large scale and very large horizon of human capacities.
This is why we formed this body, IASRM, International Association of Stem Cell and Regenerative Medicine. And the basic objective of that organization to create a global platform where we can be very friendly with the multicultural practitioners, multicultural scientists, to create a platform to get all together, share their ideas, share their knowledge, and make this science more robust. And if you are sharing, this science, regenerative medicine, not only contains this, okay, fine, it's a stem cells is the source, is this. This is a multidisciplinary approach. It's from multidisciplinaries, and if you combine the genetics in that, like if this year Nobel Prize goes to the genome editing tools, so like many other specialties combines from like gene therapy, genome editing, immunotherapy, translational therapy, molecular medicine, nanotheranostics, nanomedicine. So these all combine together, like see, nano-based, the nanotherapeutic based drug delivery. Always the therapeutic drug delivery is the challenge is the neurological disorders like multiple sclerosis, Alzheimer, Parkinson, ataxia. So these all signs are combining each other. Even in the diabetes, like encapsulated, something can be made, encapsulated drug delivery system directly to the pancreas, which will give the sustained release effect with the regenerative medicine. So these are the various scope in the science. Just think, wherever you can think, you can grow. This is the limit of this growing science, and this is how IASRM contributing in educational as an educational platform. We are conducting various fellowship courses and diploma courses in stem cell and regenerative medicine dedicated to the physicians as well as the researchers, and need the support of all over in the world from all of the medical colleagues.
Exactly, because this is how you learn from each other. I'm gynecologist, you are, cardiologist, you are orthopedic, so we all can grow together and learn from each other. And for example, when it was this COVID, when the COVID started and everything was locked down, the International Association of Stem Cell and Regenerative Medicine, where we all are apart from, Prabhu is the president, I'm the vice president, and the executive committee member and senior member, of course, and faculty. So we conducted a lot of free webinars for all kinds of doctors, for gynecologists, for orthopedics, for different specialties. All of them were free in order to educate and start to have like an international community where we all talk together. And for example, we have an interesting case. We say, did everyone have this kind of case? And we discuss on that patient's case, because every patient is different, but we can all learn from our experience. So for doctors that are interested to learn more about this kind of regenerative medicine, there exists a a fellowship as well. A fellowship means that you will deeply study this regenerative medicine. Now it will be online because we have doctors from all over the world, and you cannot travel every month. So every month you have online courses and trainings. And at the end of the year, it will be a 7 days hands-on where you can practically do what you studied and what you learned in this year. And the hands-on will be in New Delhi, India, because there is permitted to have the stem cells and all this kind of regenerative medicine treatments. So you want to add anything?
No. See, stem cell is still restricted for various countries. Even in India, there is like highly regulated. But the thing is, currently, like autologous minimal manipulation is permissible into the clinics. But ultimately, clinical trials is nowhere stopped. We should do in a proper ethical research, ethical clinical trials, and and the most important, you should have some basic training. So that's how this is the aim of this course. And if we are lacking on the training, lacking on the subject, we cannot justify to ourselves and patients.
Yes, and we'll do the course and congress in Dubai as well with our guest. We are the guests here.
We are our host and the dearest friend.
Yes, our dearest friend. That always is a pleasure to be here. And thank you again for the invitation.
Thank you being here. Thank you for all this nice interview and the information. I think when we call somebody scientist, the first character after knowledge, being serious and being persevering as well, is sharing. Sharing knowledge, it's high quality in a human being. So let's share the knowledge all together.
Let's share together and go up.
Bye-bye.
Bye-bye. Have a nice day.